Hi, everyone, and welcome. This is the Aeroflow Health webinar on improving diabetes care using nutrition therapy, strategic partnerships, and patient-generated data. It does take a minute or two for people to join. So while we're waiting, if people would just go ahead and put in the chat your name and where you're from, love to have a better sense of who's in our audience so we can interact more effectively today. Again, while we're waiting for a few more people to join, if everyone wants to put in the chat where they're from, that's great. It's nice to see some names popping in there already. And welcome to everyone. I'm really looking forward to a great conversation with you today. Okay, so I think we've reached a critical mass. Let's begin. Thank you so much for joining us today. This is the Aeroflow Health webinar on improving diabetes care using nutrition therapy, strategic partnerships, and patient-generated data. My name is Mike Cantor. I'm going to be the moderator for today, and I'm going to go through some introductory slides, and then we're going to jump into the conversation with our panel. As we go along, please feel free to continue introducing yourselves in terms of your name, where you're from. I really appreciate you being here with us today. For those of you watching recorded version, if you have thoughts or feedback, feel free to send us those by email later on. So let's begin. The goal of this webinar, this is really part of a series we're doing called the Aeroflow Advantage Be in the Flow webinar series, is really to bring to you better ideas about how health plans can manage their populations and improve quality, improve patient experience, and reduce costs. Last webinar, we also spoke about diabetes way back in November with Dr. Gabay and had a great discussion about how to improve management, what's happening with the use of continuous glucose monitors or CGMs to enable patients to better manage their care and their diabetes. Today, we have the opportunity to make this more interactive. So please, if you have questions that come up as we go along, put them in the chat. We'll be watching that and we'll be able to incorporate those questions as we go through our panel discussion. We'll also have time at the end for questions and answers that we get from the audience. So please feel free to add questions if you're joining us today live. We're lucky to have a very distinguished panel with us today. As I mentioned, I'm Mike Cantor. I'm the Chief Medical Advisor for Aeroflow Health. I'm a geriatrician and a lawyer by background with a lot of experience working as a health plan and health system and provider working for organizations that support those as a Chief Medical Officer. I'm joined today by Sophie Lauver, who is a dietitian and works in the Aeroflow Medical Nutrition Therapy Program. Also with Ryan Bullock, who is the Chief Strategy Officer for Aeroflow Health, and Carson Moore, who is the Director of Aeroflow Diabetes. So welcome, panel. Really looking forward to this discussion. We've had some great conversations already in terms of what to talk about today. Really what we're trying to do is figure out how do we improve care of people with diabetes. And there are definitely better ways to do this. Those better ways use nutrition therapy. They're really seen as partnerships and strategic alliances to make sure that we're bringing as many resources as possible to people with diabetes so that they can improve the management of their disease and maintain their health. And, we really use data to drive these decisions to figure out how do we use the data to empower health plans and their partners to really do a great job of managing people with diabetes. Now, why do we care? Why is diabetes important? Here's some cost data to share with you. It costs us a lot of money, over $300 billion a year as a country. The reason for that is it's incredibly common. According to the CDC, if you add up the people with diabetes and prediabetes, the majority of Americans have one of those two conditions. So what that means is that it is more normal, more common to have prediabetes or diabetes than it is to not have that. And that's a problem for obvious reasons, because this leads to incredible medical burdens on patients. Everything you do when you have diabetes, everything you eat, every time you move, how much you drink affects your illness, and your illness affects you. So it's one of these conditions that you may feel fine, but if you're not paying attention, you can go from feeling fine to feeling terrible very quickly. And so you have to always be conscious of how you're managing your blood sugars, how you're managing your food, how you exercise, both to maintain your health and just to make sure that you're able to keep doing the things that you want to do. And interestingly, we've actually started at Aeroflow to ask patients what are their concerns, and we'll talk a bit more about that later on. Meanwhile, understand that this is an incredibly common, very expensive. It also has morbidity and mortality that go with it. And interestingly, it's even more expensive for women on average, even though women are less likely to have diabetes. So welcome to everyone. This is a very important topic, and let's jump in to some of the questions. I'm going to start by asking Sophie, how do DME providers, durable medical equipment providers like Aeroflow, contribute to improving diabetes management beyond simply supplying medical devices, which has been the traditional role of durable medical equipment companies? Can you explain more about how that works and share with us some details about what Aeroflow is doing?
Yeah, absolutely. I think the interesting thing is that we are recognizing that the patient's health journey doesn't stop once they receive that continuous glucose monitor or the CGM. So in order for the patient to use the CGM successfully and to see the results that we know to be true, they really need to be supported from the beginning. So this starts with our team offering support with CGM setup, troubleshooting, diabetes self-management classes, medical nutrition therapy classes, and sessions with our qualified dietitians. Patients really need to understand how to interpret what they're seeing on the CGM, what the alerts mean, maybe most importantly, how they can impact their glucose readings, and how to set up their device in a way that works for them. I think also unique to us is that we are recognizing the value of the relationship between the patient and the dietitian, the patient and our sales team, and we're really working to provide a world-class customer experience to ensure that patients feel heard, that they have an easy time getting their supplies, and that they have quick access to resources that allow them to persevere when diabetes management gets challenging, because we know that diabetes distress is real. Obviously, the problem is huge, like you're saying, and we really do our best to put measures into place to make that journey as easy as possible for them.
Great. And what are the, oops, sorry, the slide moved on me. Here we go. What do you think are the new things that you're doing at Aeroflow in the last few months? I know you've started some new programs. How is that different than what you were doing before? And why did you decide to change what you were doing?
Yeah, so just this week, actually, we have launched our diabetes self-management program that's accredited by ADCES. That's the Association of Diabetes Care and Education Specialists. So this is in addition to our existing medical nutrition therapy offerings. And the reason we decided to start this program is that we felt like there was a need for additional education for our patients and additional support for our patients relating to their disease. So we're working to support patients with knowledge about the condition, skills on management, support, meeting with other patients who have diabetes to establish that common ground with others, and working on behavior change strategies so that they can ultimately better control their diabetes and have a reduced risk of complications in the long term. So this program offers up to 10 hours with a qualified dietitian of diabetes education. It's largely group-based, with the exception of that initial session, which is a one-on-one session with the dietitian. And the program is very tailored to the patient-specific journey, so that the classes they're going to take may differ from that of another patient. Ultimately, the topics, that we can go over are things like nutrition, medications, movement, reducing the risk of complications, how to monitor their glucose, and then things like healthy coping and problem solving, which we know can really support their core skills as well.
Fantastic. And what's the reception been? I know that the nutritionist has been working at Aeroflow for a while now. Have you measured sort of what people think about the services that they're getting?
Yeah, interestingly enough, we started offering a satisfaction survey, and we found that 100% of patients have found that they feel more equipped to better manage their diabetes as a result of attending our medical nutrition therapy sessions. We don't have data on the diabetes self-management program yet. It's brand new. But we are seeing, with the medical nutrition therapy program, patients are feeling more confident after attending these sessions and these classes, and more empowered to, make these lifestyle changes with our team's support.
Excellent. Carson, let me ask you, I mean, it's great to have the program, but really you have to understand what the people want. Like, why would someone come to this program? And I know you guys have done some surveys, about 1,400 members who were people who responded. Can you say more about what you asked, why you structured it the way you did, and what the results mean?
Yeah, absolutely. I mean, to start out with, we did survey our patient base to see, what is actually motivating them. There's all kinds of, theories and different reasons people start on CGM therapy. But we wanted to know, like, really, what do people care about? Why are they going through all this effort to change the way they've been doing things, sometimes for, decades? What's motivating them? And so we asked them. And that was kind of the first part of the survey was, what is your primary goal with continuous glucose monitoring therapy? And overwhelmingly, the response was they wanted to control their their glucose levels in order, and this is the important part, in order to avoid long-term complications. So, like people really care about not getting worse, right? And, that is a very motivating and powerful factor in a lot of people's lives. And so that is what we have found is spurring them to attend nutrition classes, to learn more about what the data is telling them. And then just their secondary goal is actually tends to be quality of life, and weight management is kind of what we found from that initial survey.
Very interesting. And did this surprise you?
Um, It both did and didn't. Really, if I was predicting it ahead of time, I would have said quality of life because that's what we hear so much about. That's what we see a lot of posts about and advertising about. And while that's really important to people and it's really exciting for people who, it is an impactful, wonderful change for them in their quality of life, but it was really interesting to know that really their primary factor is just to avoid long-term complications. And I think that is important for us all just to realize because I think as a healthcare system, we should all be striving for that. And I think that's what the doctors want. That's what, payers want. That's what is best for everyone in the whole system. And it's what patients want. So that's really, I think, the important message from what we learned from our patients.
Yeah, it's really interesting to me because as a physician, we tend to use what I might call scare tactics to motivate patients. And sometimes it doesn't really appear to work that well. And so it's interesting that the underlying concern about long-term consequences that they've been listening, right? Either they may have experienced some consequences already, or they've had loved ones. It's so common. Like I said, now everybody knows someone else who has diabetes, I'm sure, or pre-diabetes. So the opportunity to avoid these things is definitely what doctors tend to harp on all the time. So it's interesting that that was validated. I don't think it's the only thing, or that it's going to be effective for everyone, but interesting that people listen. And by the time we get to a CGM, you have to have had some advance in your diabetes, right? Unless you're type 1. If you're type 2, you now need to be on insulin to get to that CGM. And so you've already had to start injecting a medicine, which most people would see as a burden and complication for their life because you have to refrigerate it, measure it, all that other good stuff. So I think it's definitely interesting to see that that's the major result. But again, people really do want to lose weight, and which I think everybody does for the most part, unless you're already at a healthy weight, and also to make sure the quality of life. And I think that's a very interesting term too, because it differs. What one person's quality of life is may be different than someone else's, and that's what's so nice about having these kinds of programs that are individualized, is it allows that person to understand what their choices are and to make the right choices that lead to the best quality of life for them as they define it. So interesting data. Thank you for sharing that. Congratulations on the new program, Sophie. Excited to see where that goes. Ryan, this one's for you. So wake up. Are you ready?
I'm ready.
All right. So how do DME partnerships with health plans reduce overall healthcare costs while maintaining or improving patient outcomes? Right. It's not enough just to cut costs, because then you could just stop taking care of people. But how do you reduce the waste? The stuff that the costs that don't really add value, by partnering more closely between durable medical equipment companies like Aeroflow and health plans.
Yeah, Dr. Kander, I think that's a great question. And one of the things that we have seen to play out over and over in multiple patient populations that we help manage is first creating access to the members. I think health plans have a difficult time accessing the members that are a part of their plan. And we are in constant communication with the members. And so we have an access point as well as engagement. And so I think the two things that come to mind for me is when working with health plans and creating those partnerships is that we create access and engagement to the members. And a lot of times when when speaking with health plans, they put us in that DME bucket and think of, well, you're accessing that member to provide them for that CGM product or that sleep apnea product, DME product that we're traditionally contracted for. And one of the things that we've found is that we can, because we've created the trust with the member through providing the CGM and doing everything that Sophie had mentioned earlier with good onboarding, good compliance, and getting the member comfortable with this new device that they have, as well as providing that education, is that we can then get that member to activate and engage on other programs that the health plan may be focused on. And so I think that partnership there can help reduce some of the overall costs in the healthcare system by creating the access and engagement, extending the trust that we've established with that member. I guess as a reminder, we're talking to the member, I guess at minimum once every 3 months, if not once every month, depending on the situation. They could be attending a nutrition program. We could be contacting them about their CGM device and the need to resupply of sensors. We also have the ability to gather social determinants of health needs and helping health plans close those gaps as that's becoming more and more relevant in reducing the overall healthcare expenditure by addressing their transportation needs, their food insecurities, et cetera. So I think that's where we have found an opportunity in partnering with health plans, is looking beyond just the DME products that we're contracted for and expanding beyond that.
Got it. I think your point about patient engagement or member engagement from the plan perspective is so critical. It's one of the hardest challenges, greatest challenges, because people's lives are so busy, and getting them to pay attention, and especially when the health plan calls, they may not answer that call. Or interestingly, if you're calling from the DME company where they actually get something they need, you may have a much better chance that they're going to answer your call or respond to your email or your text or however it is that they've chosen to be communicated with. And so I think you're right. You have that contact between Aeroflow, as an example, and the patient or member that health plans just don't have. And I think one of the other major problems, in addition to member engagement, is health plans struggle with provider engagement, with understanding what are the healthcare providers doing and how does the health plan support them? How does the health plan make sure that Aeroflow is doing the right thing for their members by collaborating with providers? So Sophie and Carson, maybe you can chat about this. What strategies are really effective in improving adherence to CGM usage, and how does that relate to provider engagement specifically?
I mean, I think we can both comment on this, but to start, Mike, it starts with the physical access to the CGM, right? People need to be able to get it consistently and get it reliably. And when you start looking at the avenues in which people to have to receive a CGM, it primarily comes down to pharmacy or DME. And when you're looking at whether the consistency which they are able to actually get a CGM, it's much higher through DME. And there's a lot of reasons why, but there's a lot of so kind of to start with, access to physical inventory is a lot higher with DME. So pharmacies will stock it, but in CGM, especially if somebody is on a pump, there are not interchangeability between devices. And so people really need to be able to receive the device that they are on, the brand, the product, consistently. And that doesn't always happen with pharmacy. And then kind of secondarily, a lot of our population has transportation issues. And, by going through DME, we're able to provide that directly to their door, which is incredibly important for someone staying on that device. If they can just answer a phone call and say they're ready and have it to their door the next day, they're much more likely to stay on it than if they go to a pharmacy and they don't have the brand they need or can't get what they need at that moment in time. And so kind of taking the next step beyond kind of the physical access aspect of it, there are a lot of complexities in the insurance space in general that could prevent someone from staying on CGM, getting on CGM, and then staying on CGM therapy. And kind of to start with, it is about helping patients navigate this kind of complex web of orders, of coverage criteria, of prior authorizations, of coinsurance, all those things. We really pride ourselves on helping be a patient advocate and helping guiding them through that complexity and making it really simple to them. And then once they're on it, there are ongoing compliance aspects that they have to continue with, right? They have to see their doctor every 6 months if they're a Medicare patient in order to stay on CGM. That's something a lot of people don't know. So, here at Aeroflow, we reach out to patients, remind them if they haven't seen their doctor, hey, make sure you're going to see your doctor. This is why. We don't want you to have an interruption in service. We want you to be able to get the product when you need it. And so we're constantly trying to help patients just understand all the different pieces and apply it to their lives and just guide them through it. So in a perfect world, they have their product every month or every 3 months without fail, and they can stay on it, for perpetuity.
Fantastic. Is there a difference, by the way, between adherence rates if the patient gets their CGM through a pharmacy benefit from a pharmacy instead of through a DME company through the durable medical equipment benefit?
Yeah, I alluded to it, but I'm glad you called that out because there are actually several studies that have came out. There was a great peer study that came out recently peer-reviewed study where they took patients at different points in their CGM journey from starting to, I believe it was 1 or 2 years kind of post that getting on the initial therapy. And at every single check-in and point, the adherence rate for the medical benefit DME channel was higher than pharmacy. And I think what impacts that is some of the things we already talked about and just helping guide patients and having that advocate there. Additionally, what was really interesting about that study I found as well is not only do people have a higher adherence rate, it found that people that did have an interruption were more likely to get back on CGM therapy if they had initially done it through the DME channel. And I think, again, that speaks to what Ryan and Sophie talked about earlier in just our efforts in reaching out to patients, continuing that relationship. Everybody has things in life that might interrupt service, but it's getting someone back on when they've fallen off or had something that disrupted it that is equally as important.
Got it. Sophie, Any thoughts about how to engage physicians or providers more broadly and the impact of that on adherence?
I mean, I think like Carson was kind of saying, we're really trying to use our relationship with the patient to encourage them to maintain regular physician visits. It really comes down to understanding that we're a piece of the puzzle, but we're not the whole picture. So everyone on the care team needs to echo these same messages, the importance of using their CGM and the benefits the device can have when we're thinking about, preventing the disease from getting worse and reducing these risks of complications. Within our diabetes self-management program, we work really hard to update physicians on how patients are doing in the program, and if there's any major challenges or blockers that are kind of getting in their way from the patient being successful, so we can make sure that the entire care team is in the loop on these critical issues. So I think, when it comes down to everybody being up to date, we prioritize that communication for sure.
Fantastic. And I
Dr.
think,
Cantor,
yeah, go ahead.
It just one point I thought was worth making is the study that Carson referenced. If anyone is interested in receiving a copy of that, we're happy to email that out afterwards. Just ping us and let us know.
Yeah, we'll also put it on the landing page for the webinar so people can link to it right there as well. So happy to make sure everyone gets access to that. And I think, one of the things that's really clear is this is complicated. It's hard to navigate. And that's probably the right term, Carson. You used it, how to navigate diabetes, let alone diabetes benefits as it applies to glucose monitor. How can companies like Aeroflow, DME companies help overcome some of those barriers to having a true continuum of care that's easy to navigate? What are some of the challenges that you see in doing that, and how have you been able to address those? Ryan, Carson, your thoughts on that?
I'm happy to take the first part of that, if that's okay. The one of the things that comes to mind, especially in working with health plans, and I know it probably has a negative stigma to it, is reimbursement. And I think it comes up often as a topic, but a couple challenges that we experience aren't necessarily with the reimbursement itself. It's something that Carson had mentioned earlier, is that it's really lack of coverage for CGM as a dual benefit in both pharmacy and DME or medical benefit within the health plan. We see that some health plans have gone to a pharmacy only benefit, and it limits access and creates abrasion with the member patient that's having to access that product. So that's one area. I do think, obviously, on the reimbursement side, the next piece is the actual cost of the CGM device. As we've seen through the pandemic and even after the pandemic, that costs continue to increase and don't necessarily match with the reimbursement rates. In some cases, those reimbursement rates are less than the cost of goods. And so one consideration might be for health plans to tie fee schedules directly to the consumer price index, very similar to how Medicare applies these increases to the Medicare fee schedule. That's
Just automatically adjust. You don't have to negotiate every month, every year, every month, or whatever. Every time the manufacturer makes a change, you're presuming that there will be inflation, which I think we're all pretty aware of these days. So that's an interesting idea.
100%.
Got it. And are there coverage barriers or other kinds of ways to educate members and patients so that they understand, like, what do you need in terms of referrals, or what is covered, what's not covered, and what should you expect in terms of out-of-pocket costs? How do you tackle that?
Do you want
Carson,
to take that one, Carson?
Either way. No, I mean, we've used the word navigating multiple times, so I'm gonna kind of stick with that a little bit because it really feels like that's what we're trying to do. And at the very base level, it starts with transparency of the process and education about the process. And it really depends, patients can come to us at different points in their diabetes journey. their diagnosis journey, and from different access points. You know, sometimes patients are coming to us directly and saying, hey, I saw this on TV, I heard about it, my friend has it, I want it, how do I get it? And other times it is a provider that's saying, hey, you need to be on this, or I really recommend you'll be on this. And those are two very different paths. And so we're constantly walking both of those paths and trying to help patients who have different levels of knowledge with the system, different levels of trust with the system, different levels of resources, to educate them about the process and to set their expectations from the beginning, right? And so it starts with helping patients understand, A, if they are covered. You know, you mentioned some different coverage nuances, right? It can get pretty complicated. There's CMS guidelines, there are different guidelines specific to payers. There's different kinds of documentation that some payers require and other payers don't. So sometimes it's the same patient and the process is totally different. But it's essentially the same, you know, human on both sides that have two very different paths they have to walk down to reach the same result. And so, you know, we take on a lot of that and just help guide patients, right? You know, so we manage all the coverage criteria. We help them understand what their coinsurance is going to be. We help them understand if there's a deductible in cases where sometimes it just doesn't make sense to go through insurance. You know, we take a patient first approach to a lot of this, and sometimes it doesn't make sense for them to go through their medical benefit. You know, and so like really it's helping people help guide people through, and then we handle all the paperwork with the doctor. All we ask of the patient is that they see their doctor every 6 months and they answer our phone calls and texts and emails. But you know, like we handle all the paperwork with the doctor. We handle all the prior authorizations. When there's appeals or anything like that, you know, people get denied on a first prior authorization, even if there is proper documentation, sometimes things happen. You know, we take that on behalf of the patient, and we keep them in the loop and say, hey, we're going to fight this fight for you, and we're going to help you get on this. We know you need it. We know you qualify. We're going to help you. And so that's just some of what we do, just even to kind of like get patients on it. And then again, it's the ongoing compliance. It's getting RXs every year or prior authorizations on a recurring basis, in addition to the compliance stuff. So that's just a little bit. Did that answer your question, Mike?
Yeah, I think so. And I think it's the challenges have to do with the way the system is designed from what health plans have had to put in place to make sure there isn't overutilization, which is a legitimate concern. And on the other hand, the more you complicate any process, the more likely it is you're going to lose people along the way. So what the need is then is to have that navigation support and advocacy and ongoing education, because health literacy remains a problem, health literacy for diabetes as well. And so understanding like what all these things mean, that's why the classes that you mentioned earlier, Sophie, are so important, because even if you've been doing this for a while, things change. What a CGM does, how it works, what the alerts mean, what the specifics of your new model are, if you have a new device, all of those things require people to be able to adapt and change how they've managed things in the past, and not only navigate their illnesses and the ups and downs, literally, of their blood sugars, but also the complexities of the healthcare system, whether it's the health plans or accessing the right providers. I mean, I guess even the access to nutritionists varies from health plans to health plan to health plan, employer to employer. In the commercial side, Medicare covers a certain amount, but you can always get more, but only sometimes. I mean, there are all these, you know, complexities. Maybe Sophie, help us understand like referrals, which seems to me to be a significant barrier, probably shouldn't be.
Yeah, I mean, when it comes to medical nutrition therapy, like you're saying, it varies based on the payer. For Medicare, they require referrals for medical nutrition therapy and diabetes self-management classes. On the commercial side, it kind of varies payer by payer, so that's a little bit more for us to keep track of in terms of who a referral is required for and how we collect that. So, you know, like with the CGM process that Carson was reviewing, there's a lot of intricacies, and we do our best to make the process as clear and streamlined as we can for patients, because if we're recognizing that it's a lot to manage, you can't even imagine how patients feel starting to enter this area. So we try to take on that burden and really make it as clear and quick and simple as it possibly can be.
Yeah, I think there's this sense among some people that they don't see the value of medical nutrition therapy, even though there's an extensive literature actually demonstrating its importance and the value in diabetes and other illnesses as well, of course. Um, what happens then is that you open up a medical nutrition therapy program last year. What was the response like? Is there demand for this from the patients, or is this something where unless the doctor threatens them with some complication, they won't go? I mean, I'm just curious because you guys aren't reaching out to doctors to get them to send patients to you. Rather, patients show up and they opt in or opt out. Has it been a lot of demand, or have you sort of had to really kind of push people to join?
I think there's a lot of demand. I think, in the past couple of years, there's really been an increase in demand for medical nutrition therapy, especially as patients realize that, insurance benefits often cover it. I think, it's kind of a backwards way of thinking that patients are still pushed into these sessions. And, most of the time patients are coming to us because they are prioritizing that quality of life, picture they have for themselves. And they know that a brighter future is possible. So I would say that it's pretty rare that we have a patient coming to us who's dreading being there. Maybe that's the patient who no shows for a session and doesn't even make it to see a dietitian. That happens. It's a challenge, but the patients who do meet with us, they're very eager to be there. And of course, like, every patient, there's certain things they're more willing to change on than others, but overall, they recognize that there is a middle ground between the dietitian's agenda and the patient's agenda, and they recognize that this can really help them reduce the risk of diabetes getting scary in the future.
Fantastic. And let me think this through. So patient comes in, they sign up, they meet with a nutritionist, dietitian, and then they decide to go to classes. You create their plan, I imagine, for education. The CGM, meanwhile, they've learned how to use it. They're starting to get the data. What do they do with all that data? Like, how does a CGM impact the way that a patient can manage their diabetes? How does it help make things easier for them instead of more complicated because they're getting now a lot more numbers?
Yeah, so, the CGM is a tool. It's providing the data for the patient around their glucose management. And medical nutrition therapy is providing the actions for the patients based on that data. So our dietitians are coaching patients on the lifestyle changes that they could make around the data. And from our perspective, if we have a patient with a CGM come to sessions, we really are able to have more actionable insights for them more quickly. We have a clear picture of how they're doing. We can measure our nutritional interventions. Without that, we are relying on finger sticks if they're checking them, or we just have their A1C to determine the improvement we need to see. So a patient having a CGM is showing us specifically, what needs to happen. We can see it on a granular level in terms of what day, what meal needs to change, and we really start much further ahead. So the sessions and the device are synergizing for the best patient outcome.
Got it. And there's a comment in the chat actually that One Health Plan HCSC actually really liberalized their medical policy when it came to coverage for continuous glucose monitors or CGMs. As you know, it's a great technology. It changes even the measure of whether or not you're successfully managing your diabetes. This whole concept of time and range, which is very specific to individuals. Instead of saying hemoglobin A1C, which is kind of a generic number that we've used for decades because that's all we had. Now we can know exactly how much time your blood sugar is spent in the target range that you have set with your doctor or provider.
Mm-hmm.
But it's very, very specific. Interestingly, they just did this. So they're not seeing the value of this yet. How long do you see? Like when you work with a patient one-on-one or they're in a group, is it weeks, months, years before they figure this out? Or do they either figure it out or get off of it? What is the trajectory of being able to incorporate the CGM into how you manage your life?
How long does it take in terms of like how quickly can we see the impact of the M&T sessions? It can happen really quickly. I mean, that's kind of the, the amazing thing about CGMs is that you get that instantaneous information about how something's working. So it definitely improves patients' interest in using the devices and their adherence, because we can talk till our ears are blue about the benefits of making a specific lifestyle change, but until they try it themselves and see the impact on their glucose, I think that's really where the magic happens. So, we can see a meal that's especially high in carbohydrates versus a balanced meal and how that affects them in real time. We can see a good night's sleep. We can see a really stressful day. And so, also like if a patient is experiencing really high glucose and they go for a walk or they incorporate some movement, they can see that right away in terms of how that affects them. So I think it really legitimizes the advice that we often provide to patients, and it supports them in staying with the device long term.
Yeah, that's the thing about diabetes. It's literally minute to minute, your blood sugar is changing and you can watch it, and you're exercising or eating, and that has or emotionally stressed or joyous or whatever. All these things impact blood sugar. And so it's so interesting to get that very personalized, very specific in real time measure of the impact. And so it's great that we now have those tools. I see there's some more comments in the chat, and would like to encourage people, if they have questions they'd like to ask or comments, to put them in the chat. One question we just got is, do you have an email list that referring practices or doctors can join to stay updated? Is there a web page so that providers can actually see what's going on with the program and understand? Obviously, you can put specific patient information, but is there a way that interested providers could access information about the program in Aeroflow?
We do have various emails we send out. We don't have one specifically tailored to providers at this point, but Laura, I can connect with you after the session and we can figure out the best way to transmit that information and keep you regularly up to date. Because it is something, as we launch our DSMES program now, that we're working to stay in better touch with our referring providers.
Fantastic. And I think that's, as we talked about, two major challenges for health plans: patient engagement, provider engagement. So whatever we can do as their partner to, unquote, help with both, I think that's one of Aeroflow's real opportunities and strengths. We can't have a webinar or any conversation, it seems, these days without talking about artificial intelligence. So Carson, this one's for you. What role does AI or predictive analytics or machine learning, whatever you want, algorithmic approach to care, how do you use those new tools to take CGM data, identify at-risk members, and intervene proactively? Like, what's the way to use this new methodology to be able to take in massive amounts of data about people and then prioritize how best to respond, or even understand what the best response might be?
Yeah. So AI, like you said, it's such a buzzword and it means so many different things. And there's so many different levels of AI that I almost hate using the word, just because it can be very, very different things. But at the most basic level, the biggest benefit that we see right now is in trending real data and then real personalized data of that actual person's readings, and then providing them coaching or insight based on it. So in kind of more AI technical terms, it's summarizing existing data and then providing it back to them, right? So that's where kind of machine learning and some of the different kind of algorithms on the way their glucose levels are behaving come into play. But really, it's about boiling that down out of those terms and just kind of saying, hey, these are the trends we've noticed over the last day, over the last week. And so we actually have some digital tools that are available to patients free of charge, where they can actually connect their CGM data to our app, and it will give them daily insights and coaching based on their real data. So that's one aspect, and that's where we are today, right? Like, that is happening every day. The next kind of wave and level of it is using that data and those behaviors to predict. And so I think that's where we're seeing it going. is taking the algorithmic data, I guess you could say, of their glucose readings and saying, hey, this is where you are now, applying those trends and insights that we had just talked about gathering, and saying, based on where you are now and what we know about last time you were here or the last 100 times you were here, this is where you're probably going to be in an hour or two, right? And that's where it really starts to help get ahead and drive insights that they can change now if that outcome, that predicted outcome, is not where they want to be in an hour or two. And then thirdly, kind of the other piece, like you said, is identifying high risk or any kind of negative or costly happenstances, I guess. That's probably not the right word, but like based on their data, we can see more than, hey, this person just has a low A1C or this has low time in range. We can see this person has had levels below 54, the last 7 nights in a row, right? And we can identify that patient and surface that to a care provider and say, hey, we might need an intervention here, right? Like that's just an example, but really based on the data, you can go a lot of different directions with that. And it's about identifying something and then surfacing it to a care provider. So I think that is another kind of direction that the AI kind of landscape is going and able to do with the real glucose readings.
Yeah, I think about the Gartner model of what we do with data in healthcare. And the first level is the sort of the descriptive data. So what happened? So my blood sugar went down. Then the second level is why did it happen? Diagnostic data. Oh wow, I see from your fitness tracker that you've been running, and so that's why your blood sugar is starting to drop. The third piece is the predictive, like you said. Well, if you keep running and you don't eat something, it looks like your sugar may cross a dangerously low threshold, which leads us to the fourth level, which is prescriptive, saying, okay, now that we see you're exercising, your blood sugar is dropping, we predict your blood sugar is going to drop to a dangerously low level if you don't do something about it. Hey, stop, grab a bar, drink some carbohydrate containing fluids, whatever it is that you do to bring your sugar up in that circumstance. So that kind of putting together what happened, why did it happen, what's going to happen, and what do you need to do to either keep things going in the right path, because that's the other thing it does, is everything's fine, you're in range, or hey, you need to do something different to bring your sugar up or to bring it down. And Sophie, I'm curious, nutritionists are great, but all of us in healthcare and health and the workforce are in short supply. Is there a role for AI coaching? Like, do you see chatbots being able to be embedded into these kinds of, maybe not the CGMs, but into an app which says to you, hey, Mike, your CGM's telling me your blood sugar is dropping, grab something to eat quickly, or check out what your last insulin dose was and think about it before you give yourself more insulin in the future. Is there a role for AI chatbots?
I'm muted. Absolutely. I think it's like you're saying, there's a role for reminders and regular touch points with the patient. And that's key to keeping the patient engaged and invested in their, care and their personal health plan. I don't, taking it a step further, I don't see that as a substitute for the human to human connection, because I think there really is a role for the provider in providing, support and having that rapport with the patient. But I think for regular touch points and reminders and quick moments of engagement to prompt the patient to think about their goals and their plan and their glucose, then absolutely that's somewhere that, AI can be really useful.
Fantastic. And do you use AI health coaches or chatbots today within your program?
Yes. So like Carson was saying, we now have a program that can provide AI insights to patients based on, if they've connected their CGM to the app, they can get personalized insights about their glucose readings. In the same system, patients have the opportunity to track their food, connect with other medical providers, like they can insert their labs in there. They can connect with their fitness trackers. So the AI insights can be related to any of the integrations that they've given the okay for, to give them that outsider perspective, and regular prompts to continue to keep an eye on what the system and the patient have identified are key to their goals.
Fantastic.
And I'll
Yeah, I
just
think it's,
add to that real quick, Mike. Sorry to
go ahead.
interrupt there. But
No.
I think one of the misconceptions or the fears of AI, especially when it comes to actually giving care advice, is the trust level, right? Where is this information coming from? What kind of advice it is actually giving? And like Sophie said, it's absolutely not meant to replace the provider in this relationship. However, there is a middle ground as well. So like, for example, the application we use that gives its coaching is an FDA approved class 2 software. We have taken all the rule sets, all the different coaching advice, and it has been medically reviewed. So this is not a chatbot that's out there on its own, surfacing the web, pulling from a blog here, a blog there, and saying, hey, you should do this. No, this was written by medical professionals for certain scenarios that meet that actual patient's real readings. So just wanted to kind of clarify that, because there is a lot of like variance in the actual accuracy of a lot of AI out there.
Yeah, I'm
Agreed.
glad you mentioned that.
Yeah, thanks for bringing that up. So I see our time is zoomed by as usual, and I'd like to start wrapping up. But before I go, one of the questions I always like to ask is sort of for each of you panelists, what's giving you hope about the future as you think about the CGMs, the new programs that are coming out, AI, what we're learning about how to manage diabetes, new medications? What's giving you hope as you look ahead, and encourages you as you think about the future of helping people with diabetes? Who'd like to start?
I
I
mean,
mean, I think, go ahead, Carson.
you got it.
Okay. I think for me, what gives me hope is the attention that nutrition is getting now, and the acceptance that nutrition is, a main predictor of our health, and that's being acknowledged. With a lot of conditions, can be as valuable as a pharmaceutical. And so the fact that we now have multiple programs that focus on educating patients about the value of food and supporting them through their health journey and educating them about, the disease of diabetes, it gives me hope that we can now provide this evidence-based information, and we're getting the support of, most payers in this effort. So I think we are a lot further ahead than we used to be, that, patients and providers and payers are all uniting towards this very actionable step of including nutrition interventions in a patient's overall health care. So I think that lets me sleep at night.
Fantastic. Carson.
I mean, I definitely second everything Sophie said, and that was a lot of the excitement level and the appreciation and just the recognition of all parties that things are moving forward is awesome. What I wanted to add was, I'm in a pretty fortunate situation, and I see every review that comes in. I see every comment that is made from our existing patients. And what actually gives me hope, and on a day-to-day basis, is seeing the impact that some of this stuff is already doing in patients' lives. I mean, my favorite email to get is actually the one that says someone left a review for Aeroflow diabetes, because I know it's going to be positive, and that's just the service that we do. But B, just hearing in people's own words things like, where have you been all my life? And this changed my life. And you made it so easy. And I've been trying to do this for years and not been able to. Like, that's the type stuff that actually gives me motivation in addition to hope, because I know there's more people out there who are struggling with it, and we just got to reach them.
Agreed, and very well said. Both of you actually made excellent points. Ryan, last but not least.
Yeah, I guess I agree with everything that Sophie and Carson just mentioned. I think for me, the recent expansion of the telehealth policy through September gives me hope because it allows us to connect with members through a telehealth setting and meeting that member where they want to be met, how they want to be met, and allowing Sophie and her team to do the great work that they do. I think the other thing that gives me hope is, as Sophia mentioned, I think nutrition is coming to the forefront and being made more aware of the impact on the overall healthcare of each and every one of us. And CMS, even last year, recognizing that the number of injections per day that is needed to qualify for that entry point of a CGM device being lower from 3 to 1 per day uh, gives me hope that even maybe in the future that we can see the injection requirement being removed in those patients that are type 2 diabetics and maybe even pre-diabetic having access to CGM devices, nutrition education earlier on in that disease state. So looking forward to what the future holds there.
Absolutely. Well, thank you all so much. Really appreciate all of your contributions, very thoughtful approach, and the great work that you're doing every day. The real impact you're having on people's lives. That's one comment in the chat. It makes a difference for many people and for their families, because diabetes is also a family illness, because everyone who eats and works and lives with that person understands why their bar's around and all the rest of it. And so really great to see the improvement. Let me just wrap things up quickly and remind everyone that we'll be sending a link to the webinar so you can watch it on demand at your convenience. Please feel free to subscribe to our newsletter. Of course, you can follow us on all of our socials as well. We're happy to have you do that. There will be a survey that goes out to you. We love your feedback and suggestions on how do we make this better? How do we find the right topics? How do we continue to add value for health plans as our partners? And follow us wherever you get your social media. So thank you for joining us today. Those are watching on tape delay, thank you for joining us in the future. This has been a great discussion of how to improve care for people with diabetes, and really appreciate all of you joining us. And to our panelists, thank you for your very helpful comments. I look forward to seeing you at our next webinar, which will be coming up in just a couple of months. So stay tuned, and more great conversations ahead. Have a great day. Bye-bye.
Bye.
Thank you.